Autism spectrum disorder, it's a complex neurodevelopmental disorder. What this means is that children who have autism often have difficulties in any of a number of different fields of functioning and of development. Sometimes children may have more global developmental delays where they might have difficulty with motor functions, so how they move around, including their fine motor skills. Areas that often tend to be affected in children with autism include language. This could be expressive language in terms of how they communicate verbally, or a mix of expressive and receptive language in terms of how much of what you say is your child able to understand, and then how much are they able to communicate back to you verbally. It might include social interaction. Children who have autism spectrum disorder often tend to be more withdrawn. They tend to prefer to play by themselves even when they're around other children their age. They may tend to hide and prefer to be alone when they feel overwhelmed or when they're in new places, when they're in places where there's a lot going on. And that kind of ties into the third sphere, which is sensory processing. So children who have autism spectrum disorder tend to process sensations differently. These could be noises. For example, children with autism, some children might be very sensitive to loud sounds where they go hide when you have the vacuum cleaner on. Some of them may be very sensitive to textures, and this takes the form of sometimes very picky eaters who have very restricted diet where they're only okay with certain textures of food, or children who are very particular about what they wear, where they don't like the feeling of certain clothing on their skin, or children who, when they're playing, seek a certain sensory stimulation again over and over again. So when they're playing, for example, this might include repetitively just using a toy to make a noise, or using a component of the toy rather than using the toy as an object in itself. So if I had a doll, I would use the doll to make a noise and hit it against something, but I may not always use it as a doll. It's much more common than you would think. The CDC estimated that about 1 in 36 children in the United States has a diagnosis of autism spectrum disorder. That's a lot. And the good thing about it is that it doesn't mean that there's an increase in how many children are getting autism. It means that we're getting better at identifying it. And part of the reason why we're prioritizing identifying it is because then we can help these children get the help that they need. This might include therapy services like ABA therapy. It might include occupational or speech therapy. It might include an individualized education program at school that gives them certain accommodations. The overall goal is to help your child be the best that they can be. A question a lot of my patients' parents have for me is, I'm worried my child might have autism. What kind of life are they going to have? Are they going to be able to be independent? Are they going to be able to get married and have a family? Are they going to be able to go to college and study to be a doctor? And I think key to understanding this is the fact that autism isn't just a single diagnosis. It's autism spectrum disorder, which means that it encompasses a wide range of severity, a wide range of symptoms. At the least severe end of the spectrum, you might have a child who has some sensory issues, a little bit of language delay. They might prefer to play by themselves and have a little bit of trouble engaging with other children in their preschool. While on the severe end of the spectrum, you have children who may be dependent on other people for their daily activities, who might need a high level of supervision, who may or may not be able to express themselves verbally. And so no matter where a child falls on the spectrum, it's important to understand that a diagnosis of autism spectrum disorder does not preclude your child from having a happy, fulfilling life that's full of love. And what's important is to recognize what your child needs and to be able to get them that help that they need in a timely manner to be able to set them up for success. And success, it looks different for each child. It looks different for every family. What matters is that you have a care team that will work with you to help you reach that definition of success. Having a team which continues to follow and who knows your child and continues to follow them and is able to understand what they need and is able to work with your family to help give you all the support that you need is very, very, very helpful when you are parenting a child with autism.